Hi, this is Dr. Dennis Nikitow, and welcome to another edition of the Chiropractic Approach Show. On this particular series, what I want to share with you is the core philosophy of chiropractic. You know, a lot of people think chiropractors are back pain doctors, and we're not back pain doctors. We never were back pain doctors. In fact, the first chiropractic patient did not have back pain. He was totally deaf, and he was a janitor working in Davenport, Iowa, and he was working in a Dr. Palmer's suite when Palmer said to him, "Hey, Harvey," his name was Harvey Lillard, "how did you get deaf?" And Harvey had said to him, "I was stooped underneath a stairwell about 17 or 18 years ago, and I heard a pop in my back, and next thing I knew, I went deaf." Palmer had been studying the spine and the nervous system, and what he said was, you know what, it's very possible one of these bones is out of alignment in the spine. After checking him, he made what we now call an adjustment to free the pressure on the nerve. So after the third adjustment, Harvey Lillard was able to hear a watch ticking from across the room in the wagon wheels from the Putnam building, from the third floor of the Putnam building on Brady Street in Davenport, Iowa. He was able to hear the wagon wheels going down in the street there. So Palmer started advertising, "I've got the cure for hearing." People would come in for hearing problems. Not everybody's hearing would necessarily go away, but they had other issues that were going away. Headaches, emotional problems, depression, anxiety, menstrual issues, digestive issues, all sorts of things. So Palmer said, look, here's how this works. And this could be the answer to our health, that if the spine is in proper alignment, where there's no pressure on these vital nerve structures here, okay, that could mean that the body is going to function properly. In Harvey's case, he had pressure on the nerve that affected his hearing, and actually he went deaf. Now, in our clinic, we've had many patients that we've helped them with hearing problems, dizziness, vision problems, all sorts of different types of problems, sinuses, irritability, moodiness, depression, all sorts of things that now we have medical research on, but over 100 years ago when chiropractic developed, they didn't have that research. But the premise and the philosophy is the same. Now, I want to point out here a couple things. First of all, chiropractors are nerve doctors, not back pain doctors, okay? Our primary function and focus is on the nervous system. Now, we're different from a neurologist. They look for disease in the nerves or pathology. We're looking for pressure on the nerves as the nerves come out between the spine. Now, as we look at this chart over here, we see a brain, we see the spinal cord, and then we see the nerves coming out between the bones here. Those nerves go to all the organs, tissues, and cells of our body, okay? Now, what does the brain control? If you said everything, that's the exact right answer. The brain has to control everything. That's how God made it. So this brain is a computer, and it's computing messages coming in and giving body direction going out, but it uses the nervous system similar to the power source to this building. If we see a big generator out in the back of this building, there's going to be a big cable coming off, and those cables begin to split down to the point that we have wires. And those wires now will go to different lights. Okay, so that's how the nerves are networking through our body. Now, the other function of the brain, besides being a computer, is it delivers a brain impulse, an electrical impulse that actually keeps us alive. So if we look at this chart here, this brain impulse has to be directed down the spinal cord, out the nerves, with no pressure or interference, okay? Now, all these cells and tissues, they need food, water, they need oxygen, but they also need nerve impulse because, see, cells only have a lifespan of a short amount of time. Like you have 120 days, you have blood cells. I mean, within 3 months, you have a new heart. You have a new liver. In fact, everything inside of your body is new within 3 months, okay? People once thought 7 years. You have an actual new stomach in 4 days, and the lining of your stomach is new within 5 minutes. So if you look at any histology book, that's important. But to build healthy cells that are functioning normally, you have to have proper food, proper water, proper oxygen, but you also have to have proper nerve supply. You know, we put so much emphasis on things like free radicals and all these types of things, so we are always looking at nutrition. But those are all the chemical sides of healthcare. If we look at the physical sides of healthcare, nobody is doing anything about the physical side of healthcare except chiropractors. We examine posture, we examine the spine, because let's look at this real quick. If the generator went out in this building, all the lights would go out, and it wouldn't matter if you changed light bulbs. Well, if the brain stops, what happens to the body? You're legally dead. And it's the brain impulse that has to stop, not the heart. They can start the heart with electrical impulses when they defibrillate you in the hospital and they say clear and they shock you, okay? But if the brain stops, you're legally dead. Well, what if we came out here and cut this nerve, severed it with a scalpel? What would happen to this part that it's going to? Because this cell represents lung cells and stomach cells and liver cells and heart cells. If this was going to your eye, you wouldn't see. If it was going to your stomach, it wouldn't work. Okay, you could get all sorts of problems. If it was going down your arm, you can get paralyzed. So basically, if the brain stops, you die. But if you cut this nerve, cutting the impulse is just like cutting the wire that's going to this light. That light will never work unless you connect that wire. Okay, so if you cut this nerve here and this is going to die, then what happens if the bone is out of place? Well, if the bones in the spine twist or shift, that's called a subluxation. That's what chiropractors work with. Now, if you're going to a chiropractor who hasn't explained this core philosophy, you need to make sure you get to a chiropractor who is working with you based on the core of what this profession has been built on. And it's been built on this word called subluxation. Vertebral subluxation can be one bone out of alignment. Usually we see them in multiple bones, or you can see the whole position of a neck. Like for instance, if your neck does not have a normal curve and it's too straight, or if you have what's called forward head posture, that would be considered a subluxated neck. Well, here's the process of subluxation. Now, a lot of people think that if something's out of alignment, you're going to feel pain. Not so. Subluxations are like cancer, heart disease, or like cavities, okay? We go to a dentist to find out if we have a cavity in our teeth. And oftentimes they find a problem like gum disease or cavities or things like that, but you don't have a symptom going in, okay? Same thing when you go to a doctor and they find maybe a tumor or something like that. Well, a subluxation is the same way. Everybody should have a chiropractor and a healthcare team for this one reason. Because subluxations are misalignments of the bone. They put extra pressure on the discs, joints, and nerves, and they will start to cause an interference to that normal electrical impulse that has to go to those cells for those cells to rebuild. So if cells are dying and they start replacing with damaged cells, or if you have a subluxation, it's like putting a rubber band on your finger and leaving that rubber band on your finger for over a period of time. Eventually, that area will get a state of disease, okay, or what we call dis-ease. Now, the word dis-ease means lack of health. Ease means health, and dis means lack of. So the word dis-ease means lack of health. So if you're subluxated, if you have bones out of place where your spine is crooked and there's pressure occurring on these specific nerves where those nerve openings are being compressed, you will not necessarily feel pain right away. Okay, it's very important you understand that. It's just like stepping on a garden hose that's going to a plant. That plant isn't going to just fall right over. It's going to take time for those cells of the plant to damage because it's losing one of its vital forces for life, which is water, okay? So basically, when you're subluxated, you're breaking down cell structures until finally you get into a state of damage. You can damage the tissues, okay? You can get an imbalance, like in hormones, that the brain is trying to explain to the body how to create thyroid hormones or adrenal gland hormones or pancreas hormones. You can get dysfunction occurring in an organ, like the stomach won't work. You can get digestive problems. You can get lung problems, asthma, like that's what I had before I became a chiropractor. I was going to be an optometrist, okay? Well, when that subluxation occurs, the next step is it causes a state of dis-ease. Now, it does not cause a symptom, okay? The symptom comes after you've built up a number of damaged cells and tissues, you hit a threshold, and then you get the symptom. Now, the symptom could be pain, it could be numbness, it could be tingling, or it could be a lot of organ dysfunction. So what we look for is when we look at your spine, we're looking for your posture first because the posture tells us exactly what's going on. If you have a high shoulder, or if you have a high skull on one side, or if you're twisted or rotated, anything like that, or you can have a shift of your hip one way or a shift of your torso, that can cause a lot of problems, and people don't often see that. We look from the side for a forward head posture. These are things that can cause problems with headaches and irritability, moodiness. There's a lot of medical research that supports chiropractic and subluxation. In fact, this medical research here points to showing that you can get depression, you can get visual problems, blindness, dizziness, heart rhythm disorders. You can have problems with irritable bowel. There's a study right here that says, in a Scandinavian study, gastroenterologists found that 72% of patients with abdominal pain, irritable bowel, and heartburn had subluxations of the spine in the areas that supply the nerves to the abdomen. There's another one here by a Czechoslovakian neurologist that says, here changes found in the spinal column are linked to tachycardia, which is racing, skipping beats of the heart, in such a way that when we normalize the function of the spinal column, the heart rhythm also became normal and remained so as long as there was no relapse in the spinal column. I mean, we see studies here on ulcers. Here's one from the Journal of the American Medical Association. Scoliosis of even a slight degree involving segments corresponding to the stomach and duodenum, that is the thoracic 6 through 9, seem to play a part in 90% of patients with peptic ulcer. Well, who would go to a chiropractor for a peptic ulcer? Yet the Journal of the American Medical Association said that just a slight scoliosis, which is just a small shift of the spine in this area, thoracic 6 through 9, if we look at thoracic 6 through 9, those nerves go right to the stomach. So what happens is when the subluxation occurs, what happens is the nerves get interfered with and you don't get the proper amount of nerve supply, just like taking a dimmer switch to a light bulb. See, patients are always reaching for pills. You can take a million different pills, whether they're natural health food store pills or you can take pills from the doctor. It's not going to help if you got a subluxation any more than it would help by putting more light bulbs in the light socket if the dimmer switch was on. You got to go to the power source, turn on the power so the electrical impulses can come back to those cells and tissues and the body could heal by itself. Now, if we look at subluxations, different causes of subluxations could be trauma, postural habits that we do. Nowadays, we do a lot of work in computers, texting. Kids, have all sorts of problems like that, so they're starting to develop this forward head posture. Well, as those subluxations occur, it's right in this section right here where the patient gets a symptom. Also, when you start adjusting with a chiropractor, it's very important to know this. If you're going to a corrective care chiropractor, like us, what we do is we actually fix the spine so it's fixed. So if you have a crooked spine, like a scoliosis, what we'll actually do is we'll identify those patterns, we'll change the memory on how the nervous system is firing to muscles and straighten out the spine so the spine can eventually come back to center. If your head's too far forward, we'll be doing adjustments to bring that back into position this way. Now, most of the symptoms go away right at this point. You typically don't have a lot of symptoms in this level, but if you're only going to a chiropractor that treats symptoms and has never taken an x-ray, they'll never know if your spine is really fixed. So you have to go to someone who's going to take an initial x-ray to show your spine's out of alignment or subluxated, and then take another x-ray later. Be smart consumers. Why would we take an x-ray to begin with if we were and say you're out of alignment or subluxated and never show you another x-ray? In our clinic, we always show patients before and after x-rays because it's not based on, the spinal correction is not based on the symptom. It's based on the spinal correction to free up the nerves so the body can be at its optimum health potential. Remember, you can't feel nerves or nerve impulses flowing through your body. You can't feel the lack of nerve impulse flowing through your body either as a result of the subluxation. So it's really, really important we understand that. The last concept I want to make sure you understand is that once your spine is fixed to this level, it's very important to maintain your spine back into its position and keep it there, because periodic adjustments over time. Now, most patients, they can come in maybe once a month or 12 times a year to get a check for adjustments. Some patients, if they have more severe problems, it would be twice a month. If there's very severe arthritis, it may be once a week. It really depends on each specific case. But you don't ever want to manage your case by pain because, folks, listen, subluxations, again, are silent, okay, just like we see here. There's no symptom when you get a subluxation. You get damage beginning to the cells and tissues, and if we look at this particular poster called MPC, if you have something that requires maintenance and you neglect it, you will develop a problem every single time. You look at your car, you look at your lawnmower, you look at your relationships with your husband or wife or God. You don't maintain that relationship, you don't maintain that lawnmower or that car, you will develop a problem. The lack of maintenance will mean that you will develop a problem. But here's the thing about problems, they always develop silently. And they develop silently until finally you hit a point where there's enough problem that's developed, you hit a threshold, and that's when you hit the crisis point. So the MPC principle is a principle we can use in life. You want to maintain relationships with your husband and wife and God, you don't, you'll develop a problem silently until finally you end up in crisis. And that's where people get symptoms. You don't get symptoms in the problem stage. So when people say to me, oh, my husband doesn't have a problem, what they're saying is, oh, my husband doesn't have a symptom. You can have a bad problem, but not have the symptom yet. That's very important. You put a rubber band on your finger and tie it real tight. You don't feel it right away. But if you leave it there long enough, eventually you'll hit a crisis point. And in subluxation, if the spine isn't maintained in its proper alignment over your lifetime, what's going to happen, you'll develop subluxation silently. It's going to cause wear and tear to the discs, the joints, and the nerves. That nerve impulse, once it's altered, will cause those cells to break down wherever those cells are going. If it's the eye, if it's the lung, if it's the digestive area, the emotional hormones, all those types of things, until finally you lose function in those organs and glands and tissues. And that's what the research points to. And when you're subluxated, you will build up enough of those damaged cells until finally you hit a threshold, and then you get the symptom. So I hope this helped you with your understanding about some of the core philosophy of chiropractic. Just remember these simple points. Subluxations, okay, is what chiropractors work with. We are not back pain doctors, we're nerve doctors, okay? What we're looking for, as long as this brain impulse is getting out to these cells and tissues in these organs and there's no interference, your body's going to, those cells will die and replaced with healthy cells as long as your diet and all the other parts of your health are okay. Then from the nervous system, you're going to build healthy cells. If, however, you have a subluxation, you're going to build abnormal cells or damaged cells, which is what we call the state of disease, until finally you build up enough of them, you will get a symptom. You will never know you're subluxated unless you go to a chiropractor to get checked, any more than you know you have a problem with decay in your teeth until you go to the dentist to have them checked. So again, this is Dr. Dennis Nikitow, and I want to share this chiropractic philosophy with you because if you're going to make decisions for you and your family on your health care, it's really important to understand there's just two types of chiropractors out there treating two different things. One kind of chiropractic, but two types of chiropractors. So if you want to go just treat symptoms, you can go to what we call the musculoskeletal chiropractor. If you want to go to a traditional chiropractor, that's the chiropractor that we call the wellness chiropractor, the one that's going to help you with your overall health and wellness by keeping your spine in line and your family spine in line throughout your entire lifetime by keeping on a good maintenance program so your body is free of nerve interference.